to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. I wanted to introduce myself. My name is Dr. Borrelli. I am one of the founders of Pathway Patient Advocates, and we'd like to do a Q&A session periodically about once or twice a month about different topics regarding patient advocacy, as well as what exactly a private patient advocate is, because it's somewhat a fairly new concept, especially in some states. Patient advocacy is very new, especially private patient advocacy. And a lot of people really don't know what a patient advocate is, as well as what's the difference between a private or independent patient advocate, as well compared to a patient advocate that you might have been offered at a hospital or a healthcare system or an insurance company, etc. And so I like to pick a topic during each Q&A and just read some questions that were emailed to us and then give some answers. So today's topic is going to be the around the transformative impact of patient advocacy. There's different terms of the definition, there's different definitions of the term patient advocate, and it's a fairly new concept. And so with different definitions, you can understand why it's difficult to decide if you need a patient advocate or not, because many don't even really understand what a patient advocate is. And so thanks for joining, guys. So really, I wanted to tackle that topic first. So a patient advocate, often called a health advocate, medical navigator, professional advocate. I mean, there's quite a few different words that can be used for essentially the same thing. And a private patient advocate is very different from a patient advocate that you would get, again, offered at a healthcare system or insurance system, etc. And the big difference is a private patient advocate is an independent patient advocate. That means that we are non-biased. We're working directly for you, our client, and we have your best interest at hand. I can work at finding a specialist or researching a special treatment or insurance coverage, and I'm not bounded by within a certain insurance network or insurance company or a specific set of providers, because I don't work for a specific healthcare system or insurance system. And so in addition to that, private patient advocates like myself or independent patient advocates have a wealth of experience. I'm a doctor of medical science. I've worked in healthcare for over 20 years. I've definitely experienced these challenges in the healthcare system myself personally. And so I'm very equipped to and educated in this field to really support and help you navigate your issues as much as possible. One of the big things that I really focus on are patients with cancer and undiagnosed or rare diseases. And that's a good chunk of my clients. However, I can help in different capacities as well. So with that kind of introduction, I'm going to go ahead and start reading some questions that we have had emailed to us. And you may have some similar situation where you can relate to these people. And again, feel free to ask any questions. So we have a letter here from Brian. And Brian says, I am considering hiring a patient advocate for my husband, but I wanted to know what a private patient advocate is. Does that mean you're going to make decisions for me? And that's a really great question, Brian. So thank you for sending that in. A private patient advocate or independent patient advocate offers a non-biased opinion and is a non-biased individual who's not affiliated with any specific insurance company or healthcare system. And I know we just covered that a bit, but for those of you that are joining in, I wanted to just kind of re-say that. And so our role, it really is to navigate you through healthcare challenges. And it's really specialized and personalized. I don't have a script where I say the same thing to everyone else. I'm there for you when you need to. It's not set hours. You don't have to feel alone. Going through any kind of medical situation is very overwhelming. It's emotionally exhausting. And I am there for you, educated and experienced to offer what you need to get through it. And I think that's such a important thing, because many people that don't, if you don't have a private patient advocate, you're lacking that key component. And I always say it's great to have a support group such as family or friends that really are there for you, but their job is to be emotionally invested and spend time with you. They shouldn't have that extra burden to having to advocate for you as an independent patient advocate would have to. So we do get that a bit too, but we offer various support in, like I mentioned, rare diagnoses, new diagnoses, cancer care, elderly care management, medical billing issues. But the big thing is we do not make medical decisions for you. We provide you with the resources and the support so that you can make the best informed decision and then feel comfortable that you took that time or, are making an educated, very knowledgeable decision. And it kind of takes that second guessing or feeling that maybe, hey, did I really do the right choice and things like that. So that's the big thing, because there is that misconception that a patient advocate is actually making the decisions for you. And many are like, I don't want some stranger I don't know making these decisions for me. Well, that's definitely not the case. So just to get to your question, you said, I'm curious to know, instead of a plastic surgeon doing a flap surgery on a reconstructive case, can a patient request a fat transfer with implant reconstruction? That's a great question. It's a very specific question. There's many situations where that can be an option. If you had a specific case that you wanted to discuss with us, I'd be more than happy to kind of give you discuss that with you further. You can always give us a call. Our phone number is 947-517-8395, or you can even send us a direct message and we'll get back to you from Instagram. So question number two is from Lawrence. And so Lauren says, in year 2018, my mother tripped and fell and injured her hip. And she's been having pain since then, so we had her see a doctor and they said nothing was wrong with her. I believe they gave her the wrong diagnosis. I need someone who can help us in this situation. Does a private patient advocate help with that? And yes, private patient advocates can definitely help with that. I'm very sorry to hear about your situation. We can absolutely help you. This is a similar scenario that I've assisted with quite a bit. I have the capability to assist you in multiple ways. Our first priority at Pathway Patient Advocates is to find the most suitable care for you. And our team extends beyond the medical aspects of healthcare to include administrative factors such as insurance and billing, examining your medical records, looking to see where there's errors or potential gaps. If there's things that need to be fixed, we work on fixing them. We can assess and evaluate a variety of things and collaborate to determine the next steps. We can identify providers and resources that are tailored best to address your specific situation and ensure that it's the most cost-efficient approach for you as well. Our next, you're welcome, Miss Laddie. Our next letter is from Rose. So Rose says, I am having a problem with my medical bills and my insurance gave me a patient advocate, but it's not working. She never hears me or helps me at all. My friend introduced me to a patient advocate, and I want to know, what can a private patient advocate do for me? And that is a great question, one that we often get. I'm really sorry to hear that. We often do get clients that come very hopeless because they have had or tried some type of patient advocate before, it didn't work out, so then they're a little bit reluctant to try it again. And I'm here to tell you, please give it another chance, because we do have a great success with our clients. Our clients are family to us and we treat them amazing, and we have a really good long-lasting relationship with all of our clients. And so patient advocates from insurance companies or hospitals, again, often offer that biased opinions because they work for those companies. A private patient advocate doesn't have that constraint, so they can really work specifically for you. And again, independent patient advocates like myself have that experience, educational background, and really experience with navigating the healthcare system, etc., to help and do whatever measures that you need to get you the best proper care and to help you achieve those goals that you have. And it's a very specific, tailored approach to you. It's not a cookie cutter approach or customer service type response that you may have experienced with a patient advocate from a hospital or healthcare system. And so, that's again, one of the big differences that we can highlight over and over again. So also, Rose, I wanted to let you know we're not affiliated with any type of insurance company either. So if you have specific medical bills or appeals and things like that are needed, we can assist with those. Our next letter is from Chelsea. So Chelsea says, how can you help with my medical bills and insurance issues? So approximately 85% of medical bills contain errors, and I want to say that number might even be higher now. You may be receiving bills or even collection notices. You may be reluctant to get the medical care you need because you're concerned with the cost. And you're not alone with that. That's a very common concern for many, many, many patients. And here's where Pathway Patient Advocates can help. We can assist you with reviewing your medical bills, looking for errors, and submitting appeals as necessary. We can determine where the issue lies and how to get around it. Even if it looks like, the medical billing is correct, and in fact, it looks like you do owe that amount, we can figure out a way to tackle that situation. So we could either try to reduce that amount as much as possible or find ways to get it covered. Our billing and medical expertise can save you money and leave you feeling comfortable to get the medical care that you need and not being scared to get the care because of the cost or bills that you already have piled up. Question number 5 is from Beatrice. So Beatrice says, my mom was diagnosed with cancer a few weeks ago. Can a patient advocate navigate a new or existing medical condition? And Beatrice, I'm sorry to hear that. I know from experience when a family member is diagnosed with cancer, it's a really, really challenging experience and emotionally draining. And I sympathize for you. I know this is going to be a long journey, but definitely I would love the opportunity to help. I know being sick is scary, and especially one that's life-altering like cancer. We want you to know that multiple options are available, and Pathway Patient Advocates can assist you with navigating your path to manage it and make it as comfortable as possible. I want you as a daughter to be able to take as much time and enjoy time with your mom and just be there emotionally for her and make memories and try to make this experience as comfortable as possible. And I'm happy to do all that other work so you don't have to put that burden on yourself or your mom. For many, having a sick family member is emotionally exhausting and overwhelming. And as a patient advocate, I'm here for you and your family to help you navigate this process. We have an entire team here to help you get through this. This includes resources such as coordinating your care, getting second opinions, researching different treatment options. If you are in the hospital, we are available to help navigate issues that arise unexpectedly. And you don't have to travel this path alone because I'm here to help. We're all here to help. The next question is from Jean of Portland, Maine. And Jean says, do you also help with senior placement or support elderly care? And the answer is yes. As we age or develop different medical issues, we become less independent. And loss of dependence, whether minor or complete or significant, can be difficult, very difficult to adjust. There are many factors involved in choosing the best placement and care and really living situation for yourself or a loved one. As an adult, many people start experiencing this with their parents, where their parents are elderly, and now they're kind of having a role switch where the parents used to take care of them, but now that they're adult children, they have to take care of their parents, and there's really no training that we're presented with to do this. It's kind of a shocking situation, and many people don't know how to navigate it. They don't want to navigate it. It's very emotional as well, that now they have to take care of the parents, the people that used to take care of them. And we are there to help. We can definitely help. We can make the transition smooth. We can be there for both your parents or parent and yourself. And yes, we can make the entire experience a positive experience and one that isn't so difficult to accept and to work with. Our next letter is from Beverly. Beverly says, my insurance does not cover a patient advocate. Why should I pay for the extra expense? That's a great question. Many people ask that. And as an experienced patient advocate, board certified patient advocate myself, I can save you up to hundreds and thousands of dollars and help attain the medical care that you need in a more timely manner. Now, every case is different, but I have many, many cases where I have saved patients over $300,000, up to $500,000 in a variety of different situations, whether it's improper billing or something being, clients being told that, hey, I'm trying to get into this clinical trial, but it's not covered by my insurance, or I need this medication and they're telling me it's not covered by insurance, I can't afford it, things like that. We definitely work with those situations very often and can help you save not only time but also money. Not only money but also time. And time is very important when it comes to your health because many of these conditions are time sensitive, and the longer that you wait, the longer it is to manage it. And then our last question comes from Jessica. So Jessica says, I hired a private patient advocate before and he didn't help me at all. How do I trust that you're different from prior patient advocates? And that's a fair question. Thank you for bringing that up. Each patient advocate has a different level of experience and education. I would recommend you ask questions to make sure that you feel comfortable with the patient advocate that you pick. I always give the opportunity to my prospective clients to ask me, any questions that they have to determine if they feel that I'm a good fit for them. For instance, consider asking if they have experience with your specific condition, what their medical background is, how long they've been practicing for, and how are they actually going to help you achieve your goals. Your goal is to select an advocate who you can trust and that you feel confident that they're advocating for you. So you really have to also have kind of that emotional feeling where it's someone that you feel like is trustworthy, because they're ultimately going to be really involved in navigating this path with you. Our Pathway Patient Advocate team includes both medical and billing experts. Our span of knowledge is equipped to assist you in any challenge of medicine that you face. We are both experienced and educated in these fields, and and we're here to help. We are available to help clients all throughout the U.S., including other countries such as Canada. We have clients all over. We practice tele-advocacy. I have clients in Hawaii, California, New York, Maine, Idaho, Canada, all over the U.S. And we're because of that, we also have this huge pool of resources that we're able to tap into to get you the best care that you need. So that's the end of our Q&A. Thank you so much for sending letters like this. If you have additional questions, you're always welcome to send them to advocate@pathwaypa.com. And we would love to chat with you more. You can give us a call as well. Our phone number is 947-517-8395. Thanks, everyone, and have a great rest of your week. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.